right?
Yes.
Okay, perfect. So here are your discharge instructions for Birkin. So I kind of highlighted the high points. Unfortunately, she kind of has a lot of high points. So she's done really well with her breathing over the last 24 hours. She's been eating, has not had any diarrhea within the last 24 hours. So those are all really good things. She has developed a bit of a wet cough, most likely due to aspiration pneumonia. So if she continues to cough at home, that's totally fine. That should improve over the next couple of days, but don't be surprised, especially with exercise, when she's super excited, running around, being silly, that she ends up having a little bit of a cough. But she's done really well. We've weaned her out of oxygen. We'll have you continue to monitor at home for any increased respiratory effort, if her diarrhea comes back, if she doesn't want to eat, anything like that, she feels really funky, have her rechecked with us or with your primary vet, just depending on what time you notice
Is she
it.
doing well out of the oxygen chamber?
Oh yeah. She's been like a silly puppy. She's like,
Actually.
yeah. When I went to go say hi to her because I haven't. The last time I saw her was last night, and she was in oxygen, and I went to go say hi, and she like rolled out of her dog bed, and she was being like a silly little butterball.
Oh,
yeah, she's like
I've been praying for her.
way more
Everyone
personality
has.
than yesterday. So yeah, she feels great. So here's the
She's
thing.
been eating too.
She's been eating and no diarrhea, which is great. I would not be surprised if you don't see a bowel movement in like 24 to 48 hours, just because it takes a little while for the pipes to fill back up. So, now being that she's a puppy and she feels great, she wants to get crazy again, we really can't let her get too silly. She does have to be pretty much a couch potato. I just don't want her to get super excited, run around, and she start having a hard time breathing or she start coughing really bad. So for your at-home instructions, we'll have you continue to clean her little nose like she's a little baby. She's been tolerating us cleaning her nose with just like a damp gauze.
Yeah,
just
I
getting
was
the
going
little
to
boogies
ask
out.
how would I do that, because she doesn't like just
Anything around her nose.
Yeah.
Honestly, help. Have a partner that can help, like kind of hold her, and try to clean her nose. But here's the thing: if it stresses her out too badly and she's still able to breathe okay, I would honestly just skip it. Let's not stress her out too much. But she's been tolerating it pretty well. We've just been using like a damp gauze or like a damp cloth.
You're not getting a Q-tip or anything to kind of go around?
No, so what we kind of do is just like with a kid, or if you can get kind of the corner of it and like wipe, sometimes you can get, I think this is all on camera, of me basically picking my nose.
No, it's just for them.
Yeah.
So she won't forget anything.
You can usually kind of catch the corner of those little boogies and pull them out. I would not do a Q-tip because the last thing I would want to happen, I feel like I go to worst case scenarios, is she jerks her head and it breaks.
Okay.
And then you got a piece of Q-tip up her nose and then it's coming to the ER for a totally silly, totally different reason. So,
yes, ma'am.
Like I said, if she fights you too much on it and she's breathing fine, I wouldn't really be like a hard butt about it. But if it starts to get pretty clumpy, usually just wiping it and catching the corner is enough to pull it out. Avoid strenuous activities. So like I said, she can't get too crazy, can't be running around playing with the other kiddos. A couch potato.
Got it.
Doctor's
She
orders.
will be.
Yep. Monitor her ability to breathe. So Dr. Ham wrote in here that normal breathing when she's resting should be 40 breaths each minute. How we count that in hospital is get you like a little stopwatch or a second counter on your watch. I can't turn mine on. And count it for 15 seconds and then multiply it by 4, and that gets you the amount of breaths she's taking per minute.
Okay.
So obviously if she's up and moving around, she just finished eating, just finished walking out to go potty, I wouldn't be surprised if her respiratory rate does pop up over 40, just because obviously her lungs have been through a lot. But once she's at rest and like napping and snoozing, it should be less than 40.
Less than 40. Okay.
And she shouldn't be using her tummy to like really like suck in breaths like that. If you notice that, if you notice her like popping her little elbows out, like she's trying to like expand her chest bigger, or if you notice her sticking her face like up, her little nose up in the air, like she's trying to breathe, that's signs that she's struggling. She should be seen immediately by a
That's what she
veterinarian.
was doing.
Yeah, so if you see any of those things,
head was in the air.
yeah, they do that so they can try to like basically one way just straight into their lungs. So yeah, if you see that, like I said, their little elbows popping out, or if she's really using her belly to breathe, let's have her seen by somebody. Okay. Monitor her appetite, monitor her attitude. They've been really great in hospital. Hopefully they will continue being good for you at home. The Clavamox, she's going to get a 62.5 milligram, 1.5 of those tablets twice a day. It's a lower milligram than what you were prescribed by your primary vet. But we were worried the Clavamox, any antibiotic really, can be kind of rough on their tummy. So we're going to pop her dose down just a little bit to see if that treats her pneumonia, but also doesn't beat up her GI tract too much. Her next dose will be this evening around 5 o'clock with her dinner. Gabapentin, she's going to get 1.2 milliliters 3 times a day for pain. She won't need that until 4. That medication is kind of the only special one in that it's We filled it in individual syringes for you guys just to make it easier to measure. So you've got syringes in here. You've got 2 vials just because they wouldn't fit in 1 vial. And it needs to be refrigerated. That's the only special thing with it.
Okay.
So like I said, she'll get that 3 times a day. Won't get that again until 4. Proviable. This is her probiotic. She'll get 1 capsule just once a day. She won't be due for that until tomorrow morning. You can either give it to her in the capsule, or you can pop the capsule open and sprinkle it over some canned food. Yeah. And then Serenia nasal drop. She's going to get 1 drop in each nostril just once a day for the next week to 10 days. So she won't need that until tomorrow.
What is that? What is the nasal drop?
Serenia. So it just helps with like inflammation and. It can also help with their cough. Serenia has like anti-coughing properties to it as well.
Okay.
So we like to do that for these coughing kiddos. So we'll have you recheck with your primary vet in 5 days. So on the 29th, kind of middle of next week, to remove some sutures and to repeat the x-rays of her chest and make sure that those look okay. Obviously, if anything changes in the meantime, call us. Don't hesitate to call us or just bring her in. If you're like, hey, I think her breathing's weird, but I honestly can't tell, take a video and email it to us and be like, hey, should I worry about this or can I just keep watching her at home?
That is good.
And so that way, 1, we can save you guys some trip and some stress, but 2, we can give you a much quicker answer so you're not spiraling the whole drive up here.
Because we drove, it's 2 hours away from us. So.
Yeah, that's a long time to worry about your kiddo.
You guys have taken really good care of her.
Oh, well, thank you so
saved
much.
her life.
She's been a great patient, and which we don't always get with our puppies. So they tend to be kind
saved
of
her life, and I appreciate it.
Good. Well,
Yeah.
I'm so glad. Well, do y'all have any questions before y'all get out of here?
No.
Okay. Well, like I said, if you think of anything, don't hesitate to call us. We're here 24/7.
Thank you so much.
Yeah, and I'll go get her.
What kind of food were you giving her?
We were giving her some GI low fat. It's like the Royal Canin GI low fat, I believe is what she was getting. Does she get normal like puppy food at home?
Was it canned food you were giving her or kibble?
Canned food is what we were
Okay,
giving her.
so my husband bought some canned food. At home she was getting kibble. We were giving her Merrick.
Okay.
Merrick. So, but for a while I think I'm gonna do
I'll do the canned food, yeah. And you can always do some canned food, like a little kibble topper, and kind of like mix it in together if that's what she wants.
Okay.
But yeah, she's been eating canned food here and has been doing really well.
Okay,
So.
that's
okay,
fine.
Perfect. Well, let me go grab her and we'll get you guys out of here.
Thank
okay?
you so much.
You're very welcome.
It's sweet what you saw.